The doctor's in, and today we are discussing the new cholesterol guidelines just released about a few weeks ago. More Americans could end up taking cholesterol-lowering statin drugs as a result. Dr. Scott Ackerman, one of the First Coast's leading doctors, is joining us today to talk about these new recommendations, what they mean, and how it could potentially affect you. Dr. Ackerman, thanks so much for being here.
Thank you, Casey.
All right,
Good
so
to
let's
see you. Good morning.
Thank you. Okay, before we get into the new guidelines that were recently released, let's talk about statins. What exactly is a statin for people who might not know?
So statins are drugs, medications, and we use them to lower blood cholesterol levels. The common names of them you may have heard of. There's lots of advertisements on TV about these drugs. Zocor, Crestor, Lipitor, and they're very interesting in the way they work. They work in blocking a chemical in the liver that makes cholesterol. So people that have high cholesterol levels have high cholesterol levels because of two reasons. One is they ingest too much cholesterol, fatty meats, those sort of things, red meats, and also they produce cholesterol within their own body. Whether we ingest cholesterol or not, our bodies are going to make cholesterol through our liver. So some people are genetically predisposed to having high cholesterol levels. They may not eat any cholesterol, but their cholesterol levels are high because we manufacture cholesterol in our bodies. It's a natural thing. So the statins, and then it's manufactured within our liver. So statins block the production of cholesterol in the liver. And we know that we talked here before about high cholesterol. We know that it leads to atherosclerosis, which is a hardening of the arteries or plaque buildup in the arteries. And when you have this plaque build up within the walls of the arteries, you have two problems from it. One is it gives you high blood pressure because the arteries are not as elastic and it's harder to get the blood through them. Number one. Number two, the cholesterol plaques can break off and lead to a heart attack or a stroke or something like that.
So it's something you need to be taking, obviously, very seriously. Even
Correct.
if you don't eat a lot of cholesterol, like you said, you might be predisposed for it. What are the new guidelines that just came out in regards to all of this?
So recently, the American Heart Association and the American College of Cardiologists came out with a new focus on defining which groups of people need to take these statins to lower their cholesterol. They're looking specifically at those people who have the bad cholesterol, the low density lipoprotein, the LDL cholesterol. Which group of those people should have those levels lowered to be more healthy? And what they found out is that people with cardiovascular disease, people who have a low density lipoprotein or the LDL cholesterol levels of 190 or higher, people who are diabetic, or people who have an estimated 10-year risk of cardiovascular disease of 7.5% or higher. These groups are ones that are prescribed statins and also encouraged to adopt healthy lifestyle to reduce their LDL levels, like not ingesting too much red meat, that sort of things.
Okay, so how do then you determine, how does a doctor predict your 10-year risk? How would you figure that out?
Right, that last thing is kind of interesting, the
Right.
10-year risk of 7.5%. So the American College of Cardiology and the American Heart Association developed this risk calculator. And you can find this risk calculator online. It's pretty easy. It factors in your blood, your blood pressure, your age, your cholesterol levels, if you smoke or if you have diabetes. So, you know, it even has it for the iPhone or for any
There's
kind of phone.
There's an app for that? There's an app for everything.
It's amazing.
Can't it park your car yet?
Right, so I downloaded this for me, and I put in my age. I'm 55. It has it for race, whether you're African American or white, your sex, whether you're male. My cholesterol level is 140. And my HDL is 61, so I put that in.
You knew that upon going into it, obviously you have to get
because
those.
I've had mine drawn recently.
Okay, right.
And my blood pressure, which I checked this morning at my office, was 130. Okay. And I don't have hypertension, I don't smoke, and I don't have diabetes.
And
you can see here, 3.2% 10-year risk of having cardiovascular disease.
Okay, so if it's over 7.5,
then you recommend. So, but you know, the fact I'm male makes me more elevated, but 3.2% is very low.
So you're doing okay, Doc.
Today,
but take your blood pressure after this segment and find out how it's going.
If the same things were true 10 years from now, I'd be 9.1%. If only thing that changed about me was my age, being 65 instead of 55, with the same low levels of cholesterol and fairly low blood pressure and otherwise healthy, it puts me at a 9.1% risk of having heart disease in 10 years,
Which means you would probably go on statins.
according to the current guidelines.
And okay, so is there some controversy? Because it seems like a lot of people would be going on statins at some point in
Well, a
time.
lot of people are going to be. There are other organizations that have analyzed the guidelines and believe that it maybe overestimates the patient's risk, which could lead to overtreatment and overuse of statins. Now, statins are a drug like anything else. They're relatively safe, but with any drug, there's side effects and there could be other problems. So if I was 65, I probably would be on statins. But when I become 65,
Yeah, let's not advance things too quickly.
but I think that the best, as I say often, is whenever any new guidelines come around, speak with your physician. And I think it's good that these guidelines prompt people to speak to their physician, engage with your physician, find out what your risk is, and have a meaningful, intelligent discussion as to whether you should be on these medications or not.
Fascinating topic. Thank you so much, Dr. Ackerman. We appreciate you coming on and discussing this with us, and for all the good advice you give us each and every week, as always. For questions regarding today's topic or any other health questions that you might have, you can connect with Dr. Ackerman on Facebook by visiting facebook.com/First Coast Oncology.